Hello and welcome to all of you on this Mission May revision short subjects, and my name is Dr. Jhanvi. I am your anesthesia educator on Unacademy. If you guys are able to see me and hear me well, please leave a thumbs up in the chat box. I will be able to see it in the chat box. Alright, so I can see that the streaming is fine and the class has started. So welcome to this class. We are going to be discussing some of the important aspects of anesthesia revision. So all of you who joined me yesterday, this journey is for this entire month, and we are going to be discussing all the short subjects quickly. We are going to be revising all of them for your NEET PG preparation. So on the YouTube platform we are having the short subject revision, and on the special class platform we are having flashcard revision of the long subjects like surgery, pediatrics and medicine. Alright, so this class from 10 to 11, and then this will be followed by a special class at 11:15 in which we will be discussing flashcard revision of pediatrics on the special class platform. So welcome to Unacademy. I have done my MBBS, MD and DNB in anesthesiology. Now this is the Telegram channel Let's Crack NEET PG, where we have the important updates about all of our classes that we are taking. So please make sure that you join this class. This is the NEET PG free test calendar for March for week 2. So you can see that every day you have one free test available on Unacademy, and these are also your subject wise tests. Alright, the plus subscription on Unacademy will help you get access to both live and recorded classes. You can learn from India's top educators, you can compete in live tests and quizzes, and you can study on the device of your choice. Along with that, we also have the iconic subscription. The iconic subscription of Unacademy will help you guys get the resources of the plus subscription of Unacademy, and along with that you will get all the video lectures of Prep Ladder. These are our FMG toppers, and along with this we have special classes. As you guys know, they are available absolutely free for all of y'all, and these are interactive. You have raise a hand option, polls for the learners, and lecture notes in the form of PDF. Now this is our NEET PG preparation packages that we have. So you can see we have a lot of offers going on. You can buy 3 months, get 1 month free, buy 12 months, get 2 months free, and along with that you can also use my code Dr.Jhanvi Live. I'm just writing it down over here, and this code will help you get an extra 10% off on your subscription. These are the plus batches that are going on right now: the Mission INICT 2022 batch, the NEET PG 2022 High Yield MCQ Marathon batch, the Focus FMG 2022 batch, and the NEET PG 2022 All Educator Revision batch. So if you want to join any or all of these revision batches, you just need to buy one single plus subscription. So this is the plus and the iconic pricing, and on top of this pricing you can get 10% off when you use my code Dr.Jhanvi Live. Alright, so with this, let's begin with our revision for today. So yesterday you all know that we revised the regional anesthesia instruments and the important IV anesthetic agents and the inhalational anesthetic agents and the muscle relaxants. So today we are going to be continuing with the last set of drugs, and then we will be moving towards the instruments in anesthesia. So can anyone identify the class of drugs from the following? So you have a vial of lignocaine, you have a vial of bupivacaine, and you have a vial of 20% intralipid. So can you guys identify for me what class of drugs does this belong to and what is the use of the same? Good morning everyone who's joining in late. So what class of drugs does lignocaine and bupivacaine fall in, and what is the use of 20% intralipid? You guys can answer in the chat box. Okay, so lignocaine and bupivacaine are both local anesthetic agents, okay, and they are used for giving regional anesthesia. What do you mean by regional anesthesia? If you are blocking any one part of the body, that is called as regional anesthesia. Now absolutely correct, Parak. We also use lignocaine as an antiarrhythmic, so it also helps in resolving ventricular arrhythmias. Absolutely right. But more importantly, from anesthesia point of view, they are used as local anesthetics. Now when we talk about regional anesthesia, what are we mainly talking about? We are talking about central neuraxial blockade. So in that you have your spinal, epidural and caudal blocks, or we are talking about peripheral nerve blocks. Peripheral nerve blocks will be your brachial plexus block, individual nerve blocks like femoral, sciatic, all of those. Alright, so this is what we talk about whenever we use local anesthetics. Now questions that are asked about these local anesthetics. Can you guys tell me what is the most widely used local anesthetic? Most widely used local anesthetic. Just answer in the chat box below. Most widely used local anesthetic. Second question that they ask very commonly is what is the most cardiotoxic local anesthetic? Yes, very good, Meena. So the most widely used local anesthetic is lignocaine. And can you tell me what is the most cardiotoxic local anesthetic? Very good, Meena. So the most cardiotoxic local anesthetic is bupivacaine. Alright. So if you have any kind of ventricular arrhythmias or bradycardia or bradyarrhythmias after giving bupivacaine, that means the problem is because of your local anesthetic being bupivacaine. Alright. Okay. Now, after this, the question that they ask is what is the class of drugs that lignocaine and bupivacaine belong to? So your local anesthetics are divided into two classes, correct? It is divided into amides and it is divided into esters. So are these esters or amides? Are lignocaine and bupivacaine esters or amides? Can anyone tell me, are lignocaine and bupivacaine esters or amides? Okay, so I'll give you a very easy trick to remember this. Now, if you look at amide has an I in it, correct? So remember, all the amides have an extra I in them. Okay, so can you see lignocaine has two I's? It has Lignocaine. Okay, so there is an extra I over here. So this is also an amide. Okay, bupivacaine again has two I's. So bupivacaine is also having an extra I, so this is also an amide. Okay. Now, let me ask you, what about procaine? If we talk about procaine, can you tell me whether it is an amide or an ester? Procaine is amide or ester? Anyone, any idea? Okay, so procaine has a single I in it. It does not have an extra I. So this is an ester local anesthetic. Now, why is it so important? The ester local anesthetics that are there are basically metabolized by plasma cholinesterase in the plasma. Okay, so as a result of this, they have very short action because they just go into the plasma and they get broken down by plasma esterase. On the other hand, when you have amide local anesthetic, they go all the way to the liver to get metabolized. So as a result of this, the action of amide local anesthetic is much more long acting as compared to ester local anesthetic. Okay, alright. Now, next thing that they ask is what is the shortest acting local anesthetic? Shortest acting local anesthetic. So can anyone tell me the answer for this? Shortest acting local anesthetic is a single one-liner ही पूछते हैं एग्जाम में. So you all should know all these one-liners about these drugs. Anyone, what is the shortest acting local anesthetic? Okay, so the shortest acting local anesthetic is chloroprocaine. Okay, no, not lidocaine. Lidocaine is actually intermediate acting, so it acts for about 15 to 20 minutes, but your chloroprocaine will act only for 5 to 10 minutes. Okay, your bupivacaine and ropivacaine are long acting. So if they ask you short acting, in short acting we have chloroprocaine, in intermediate action we have lignocaine, and in long action we have bupivacaine and ropivacaine. Alright, so please remember all of those things. Alright, now this drug that I am showing you over here, 20% intralipid. Can you tell me what is the use of this drug of 20% intralipid? Use of 20% intralipid. Anyone? Okay. Any idea? What is the condition in which we use this? Yes, very good, Meena. So you are partially right. So this is used in a condition called as local anesthesia systemic toxicity. Okay, so you have local anesthesia systemic toxicity or LAST, in which we use 20% intralipid. So what is the use of intralipid in LAST? So basically, all your local anesthetic agents, lignocaine, bupivacaine, all of them are highly lipid soluble. So suppose there is a toxicity, suppose there is overdosage with intralipid, then overdosage with the local anesthetic. So in that case we give intralipid. So all your lignocaine, bupivacaine, whatever you have given will get absorbed by this intralipid. It is nothing but a big blob of fat. It gets absorbed in it and it gets thrown off from the body. Okay, so as a result of this you have local anesthesia systemic toxicity treatment by 20% intralipid, and this comes as a case based scenario. So how will they present? Now if someone is overdosed with local anesthetic, so you have not calculated the dose and you have given more than required, or if you have given the entire drug into the blood vessel instead of giving it around the nerve. So these lignocaine and bupivacaine will go to two places. The first place it will go to, I'm just writing about last, okay, but you guys won't be able to see because it's behind me, so I'll just talk about it. So last affects two organs mainly. It affects the brain and it affects the heart. Okay, so the local anesthetic will go to the brain and it will cause initially seizures, and then after the seizures it will cause coma. Okay, and your bupivacaine that is there, it will directly go to the heart and it will cause cardiac arrest. Okay, so as a result of this, both of them can cause the death of the patient if you have a local anesthetic systemic toxicity. So you are supposed to recognize it quickly when the patient starts getting peri-oral tingling and numbness, seizures and bradyarrhythmias. These are the three important things that should be there in the question. The patient is having local anesthetic systemic toxicity. So the question will be asked as, what is the drug of choice for the treatment of this condition? And your answer will be, drug of choice for the treatment is 20% intralipid. Okay, now many of you all get confused between the treatment of all these things. So can you tell me, dantrolene sodium is the treatment for what? Dantrolene sodium is the treatment for what? Because when I ask people what is the treatment for last, most of you all end up saying dantrolene sodium or end up marking dantrolene sodium in MCQs. So can you tell me what is the treatment? Dantrolene sodium is the treatment of what? So that we get out with the confusion. Yes, very good Rameshwar. So dantrolene sodium is the treatment of malignant hyperthermia and not last. The treatment of last is 20% intralipid. Alright? Okay. So last question that is asked about local anesthetics, so which is important for this slide, is what is the maximum dose of lignocaine with and without adrenaline, and what is the maximum dose of bupivacaine? So before giving to the patient you have to calculate the dose in mg per kg. So can you tell me what is the maximum dose of lignocaine and maximum dose of bupivacaine? Anyone? Maximum dose of lignocaine, maximum dose of bupivacaine. So lignocaine plus adrenaline and plain lignocaine, what is the maximum dose? And bupivacaine, what is the maximum dose? Bolo. Okay. किसी को आता है? Alright, the maximum dose of plain lignocaine is 5 mg per kg. When you give lignocaine along with adrenaline, you can give a higher dose. So you can give up to 7 mg per kg. Okay. And maximum dose of bupivacaine, anyone? Very good, Nivetha, Meena, correct answers. Maximum dose of bupivacaine is 2 mg per kg. So you need to know these three toxic doses. Okay. Other than this, nothing else is important, but these three toxic doses are very, very important for your exam. Alright? Okay, so this slide, just remember this flashcard, everything about local anesthetics. You don't need to know anything more. You need to know how the local anesthetics are classified into amide and ester. What are the two main local anesthetic? Lignocaine, bupivacaine. Then one liner about the local anesthetics, and then about last and the treatment of last, that is 20% intralipid, and the dosages of the commonly used local anesthetics. Alright. So got this. Now let's move on to our next set of revision pattern. So here we will be discussing the instruments in anesthesia, the ventilatory circuit in anesthesia. So I want you guys to identify what is this that I am showing you in the picture. And what is the use of this? What is being shown in the picture and what is the use of it? Bolo. This has come in your exam, by the way, guys. These pictures, these image-based questions have come in your exam. Very good, Hriday. So these are nothing but and cylinders which are carrying the gases. So can you tell me this blue colored cylinder is carrying which gas? Yes, Rameshwar, very good. Blue color cylinder is carrying nitrous oxide. Can you tell me the cylinder pressure? The pressure in the cylinder of nitrous oxide, anyone? What is the pressure of nitrous oxide cylinder? Important, guys. All these fall in the high pressure system category. Okay, so you need to know the pressure, and it is 760 mm of Hg. Okay, so nitrous oxide cylinder has pressure of 760 mm of Hg. Now this cylinder over here, black body with white shoulder. I always say that this looks like the Unacademy t-shirt. You have a black body with a white shoulder. So this is nothing but oxygen cylinder. Okay, so in oxygen cylinder, what is the pressure that you get? In oxygen cylinder, the pressure that we get is 1900 psi. Okay, so you can also remember it as Unacademy is the oxygen for your preparation for NEET PG. Alright, okay. Grey color cylinder, anyone? PSI is pound per square inch. I'm so sorry, guys, even this over here is 760 psi, not mm of Hg. That is atmospheric pressure. So nitrous oxide cylinder is also 760 psi, pound per square inch. Okay, grey color cylinder, can anyone identify what is there in grey color cylinder? What is the gas in grey color and what is this gas? Alternate light and dark stripes, black and white stripes. Helium, no, helium is brown in color. Okay, so this one over here, grey color cylinder, it has nothing but carbon dioxide. Okay, so this is a carbon dioxide cylinder, and then this alternate stripes that you can see, dark and white stripes, this is nothing but the air cylinder. Okay, so you need to know the colors of all of these cylinders, very important for the exam. Alright, now other than these cylinders, you also need to know the color of the pipelines. So I am going to write the pipeline color over here. So remember, these are all the cylinder colors and then we have the pipeline colors. So can you tell me what will be the color of nitrous oxide pipeline? Nitrous oxide pipeline color. So एक ही flashcard में you can revise all the colors. Now why is this color coding important? Remember, whenever you are using these gases for anesthesia, you should not be connecting the wrong gas to the wrong port inside the anesthesia machine, because if your patient starts developing hypoxia and you try to increase the oxygen levels, and suppose you have connected nitrous oxide or carbon dioxide accidentally to the oxygen port, you will be increasing the hypoxia of the patient by giving him excessive nitrous oxide or carbon dioxide, and you won't even realize and your patient can die. Okay, so that is why it's important to have correct color coding so that you can identify the cylinder or the pipeline and attach it to the correct place in behind the anesthesia machine. Okay, all right, so nitrous oxide is blue. Can anyone tell me what is the color of oxygen pipeline? So I'll ask you the color of all the pipelines. I'll write it down over here. You all in the chat box, you can write it as nitrous oxide is this color, oxygen is this color. Yes, probably no, it is Rameshwar, absolutely correct. White color oxygen cylinder. Then next is your yellow color is what? Yellow colored pipeline carries what? And then your air pipeline is what color? ये चार चीज़ें मुझे बताओ. Yellow colored pipeline carries what and your air pipeline is what color? No, air is not white, oxygen is white in color, the oxygen pipeline. Very good, Swapnil. So the yellow colored pipeline has vacuum in it. So whenever you want to do suction, so we will use yellow colored pipeline. Okay, and air. Air is the same as the cylinder only. Remember, it is alternate black and white marking. Okay, alternate black and white marking. So these are all our pipelines. Alright, so this is all the pipeline colors and all the cylinder colors, all the cylinder pressures that you need to know. Can anyone tell me the pipeline pressure? Because you know in anesthesia we have high pressure, intermediate pressure and low pressure systems. Okay, so your pipelines fall in the intermediate pressure system. So the pipeline pressure, if they ask you in the exam, you should be knowing it. Cylinder falls in high pressure. We have already discussed. Nitrous oxide cylinder has 760 psi, oxygen cylinder has 1900 psi. So what will be the pipeline pressure? The pipeline pressure will be between 40 to 60 psi. Okay? All these are previously asked about anesthesia. It's not that I'm making up these questions on my own. I'm just giving you one flashcard so that before your exam you can quickly just go through this entire video in literally like 10 minutes and your entire anesthesia revision will be done. Okay, so this is all about the cylinders and the pipelines and their pressures and their color coding. Now we are moving on to the next set of instruments. This set of instruments I have discussed with you all before many times, so you should be able to answer quickly. Tell me the two names of this instrument and tell me who is the founder or who actually built these instruments. Bolo. Yes, very good. So this is called as LMA or this is called as supraglottic airway device. It is also called as SAD. Okay. So in your exam, if you get this term, don't get confused and say, "अरे मैम कुछ तो SAD बोला था, मैंने wrong mark कर दिया और अभी मैं SAD हो गया हूँ." So this is another name, supraglottic airway device or LMA, laryngeal mask airway. It was discovered by Dr. Archie Brain. Okay. Now you have first generation and second generation LMA. So can you tell me what is the main difference between first generation and second generation? I am marking over here that both of these are second generation LMAs. So can you tell me what is the difference between first and second generation LMAs? Main difference between first and second generation LMA. Okay, so if you see in first generation LMA, you have only one tubing coming out of it. So can you see there is only one tubing coming out of it? So this is the first generation LMA. If you look at second generation LMA, you have two tubings coming out of it. So what are these tubings? So one obviously has to be the airway tube. It has to carry the gases so that you can give anesthesia to your patient, correct? If you look at the second generation LMA, you have your airway tube and you have one more. This is called as your gastric tube. Okay, airway tube and gastric tube. So your gastric tube that is there, this is used for removing all the secretions or the aspirations or the food particles. Okay, so as a result of this, whatever is there, you put a Ryle's tube through this and the Ryle's tube will come out from here and go into the esophagus and you can aspirate whatever secretions or gastric aspirations you have. Alright, now let's identify each and every one of your LMAs. So can you identify for me LMA number 1, LMA number 2, LMA number 3, and then we have LMA number 4, LMA number 5 and LMA number 6. So any of you all, can you identify? Just write 1 is this, 2 is this, 3 is this, 4 is this. Let's identify all of them. So guys, we'll end this class at 11 o'clock and at 11:15 we have the special class from 11:15 to 12 o'clock, 45 minutes special class in which we'll be doing the flashcard revision of pediatrics. Okay, so don't run away after this class. Yes, very good, Swapnil. So the only first generation LMA that is asked in the exam is your LMA classic. Okay, so whenever you see a single tube that is coming out like this, single airway tube coming out, you should know that this is a first generation LMA and this is LMA classic. Okay, alright. Now the second one that you can see, it looks like LMA classic, but it has an extra port, extra gastric port that is coming. Very good. This is called as the LMA Supreme. Okay. Alright. Now this is a special type of LMA. So you can see it has an endotracheal tube inside it. Okay. So this LMA is used for intubating in difficult airway. So whenever you want to intubate, but you're not able to see the cords, you're not able to push the tube. So first you put this LMA. Through the LMA you put the endotracheal tube. So the tube will come out like this and go through the vocal cords, and then you can remove this LMA. Okay. So this is called as your, very good Niveta. So this is called as LMA fast track, or what is the other name for it of LMA fast track? This is also called as intubating LMA. LMA fast track or intubating LMA. Alright. So in LMA fast track or intubating LMA, what do we have? It helps in intubation of the patients in anticipated difficult airway. Okay, you also have this handle over here, stainless steel handle. So you can remember this LMA from this handle also, that whenever you want to push the endotracheal tube and remove the LMA, you can use this handle. Alright. Okay. Now in 4, 5 and 6, can you identify what are these LMAs? Can you guys identify these LMAs, 4, 5 and 6? Yes, very good. So 5 is a fully green LMA. Again, all these are second generation. So I'll show you the tubes. This is the airway tube, this is the gastric tube. Here this is the airway tube, big one, this is the gastric tube. Again, this is the airway tube and this is the gastric tube. Okay, so you have both the tubes over here. Yes, you have both the tubes over here. So if you try to identify this, first of all, someone has identified 5. So this is a fully green color LMA. It is also called as Ambu LMA. Okay, and what is 4 and 6? 6 is iGel LMA. Very good, Swapnil. Swapnil, can you tell us what is so special about the iGel LMA? And someone identify 4, because this is also a very important LMA. What is special about the iGel LMA? Look at all the other LMAs and then look at the iGel LMA. It looks like it is lacking something. Anyone? Can you identify what it is lacking? एकदम फोटो देखोगे तो ऐसे लगेगा अरे इसमें कुछ तो नहीं है iGel में. Okay, so very good, Swapnil. So iGel LMA, it does not have a cuff. So this is your cuff which is filled with air, and this is the pilot balloon through which you fill the cuff. Okay, so if you look at your iGel LMA, this cuff that is there, it is not present. Okay, why? So that means this does not get filled by air. So how does this expand? This expands by the heat that is present in the neck, okay, or the heat that is present in the airway. So this is made up of a thermoelastic material. It will take the heat from the airway and it will expand. So this is called as your iGel LMA. iGel LMA. Alright. Okay. Now, can anyone identify 4 for me? This is one of the most important LMAs. So you can see this 4 is different from the other LMAs. It is flesh colored. It is made up of silicon. So whenever it is made up of silicon, it is non-disposable. It can be used up to 40 times. Very good, Swapnil. This is nothing but Pro-Seal LMA. This is Pro-Seal LMA, and you can sanitize or you can sterilize the Pro-Seal LMA. Can you tell me how do you sterilize a LMA? What is the procedure of sterilization? Now if you look at all the other LMAs over here, your classic Supreme and Ambu, iGel, all of them are disposable. You use it single time in the patient and you dispose it. But if you look at Pro-Seal and Fast Track, they are made up of silicon, so they should be sterilized. So, and they can be used again and again because they're very expensive. So almost up to 30,000-40,000 rupees per LMA. So you can use it up to 40 times, and the method of sterilization is nothing but autoclave. Okay, method of sterilization is autoclave. Alright, now if I ask you, out of all these 6 LMAs, which is the LMA of choice in daycare surgery? So can you tell me what is the answer? LMA of choice in daycare surgery. Yes, very good. So your ProSeal LMA is LMA of choice in daycare surgery. Okay. Yeah. The other question that they ask about LMAs is the sizes of the LMAs. So just remember that size 3 and size 4 and size 1. These are the sizes you need to remember. So as per the weight of the patient, we put the LMA. Size 1 is used in the smallest human being, that is a newborn who is usually less than 5 kg. Size 3 is used in 3 ka 3 likh do idhar, 30 to 50 kg. And size 4 is used in 50 to 70 kg. Okay, so this is all that you need to know about the LMAs or supraglottic airway devices, all of them covered in one single slide. Alright. Okay, one second. Alright, I'm not able to see the chat box. ठीक है. Okay, सबको समझ में आ गया? Alright, now next, moving on to our next set of instruments. Can you guys identify these instruments for me and tell me what is their use? Identify these instruments for me and tell me what is their use. Yes, very good, Staphylococcus. All these are laryngoscopes. So identify for me the name of 1, 2, 3 and 4. For easy insertion of endotracheal tube, it's not for easy insertion, but it's for insertion of endotracheal tube. If you want to intubate a patient, first you have to do a laryngoscopy. You have to pull the epiglottis up and look at the vocal cords and put the tubes. So to put the epiglottis up and you have to visualize the vocal cords, you need a laryngoscope. Alright? Yeah. So tell me the names of each of these laryngoscopes. Okay, Swapnil is saying number 3 is used for intubation in adults. Okay, so I would rather refine it as it is most commonly used for intubation in adults. Okay, now your 1, 3 and 4, all of them are actually used for intubation in adults, but most commonly we prefer to use number 3. Okay, 2 is Miller's, very good. Miller's laryngoscope. And where is Miller's laryngoscope used, Hriday? 3 is Macintosh blade, very good. Excellent, Hriday has given the answer for all of them. And 4 is video laryngoscope, very good. So, and what is 1? Anyone? Do you know the name for 1? Yes, Miller's laryngoscope is used in pediatric patients for intubation, okay. And 1 is called as McCoy laryngoscope. Remember, this is called as McCoy laryngoscope. Okay, what is the use of McCoy laryngoscope? You can see over here, this is curved blade and this has a lever over here. So with the lever, when you push the lever down, this part that is there, it is flexible and it will move. Okay, so as a result of this, because of the flexible movement, you can lift up the epiglottis. So 1, that is McCoy, and 4 that is video laryngoscope. All of them, both of them can be used in anticipated difficult airway. Okay, so McCoy and video laryngoscope both can be used in anticipated difficult airway. Alright, yes. On the other hand, the straight plate laryngoscope or the Miller's laryngoscope is used in pediatric patients only. And the Macintosh laryngoscope is curved blade, it is used in adults. Alright, okay. Alright, so moving on to our next set of instruments now. So you have to identify what are these instruments, what are they used for, and you have to tell me the each and every instrument and specifically what are they used for. So I'm marking 1, 2, 3, 4 and 5. Very good, Hriday. These are endotracheal tubes. Can you tell me what endotracheal tube is? 1, 2, 3, 4, 5, all of them? कफ अनकफ ही मालूम है. अच्छा, ओके. So this one, the third one, as you can see, it does not have a cuff. Okay, so this is called as the uncuffed endotracheal tube. Absolutely correct. So Hriday, if you know this cuff uncuff one, can you tell me uncuffed tube is used in what? You are telling me this is an uncuffed tube. Number 3. So they are specifically used in what? In which set of patients? Neonates, okay, not exactly neonates, but in pediatric patients. Okay, so it is also used in infants, it is also used in small children. So we prefer to use the uncuffed tube in pediatrics so that the cuff pressure does not cause problems in the trachea. So if the cuff is overinflated, it can cause tracheal stenosis, tracheal necrosis because of ischemia to the blood supply of the trachea. So to avoid that, we use uncuffed tubes in pediatrics. Okay, nowadays we don't use uncuffed tubes, we use micro cuff tubes, which are very small cuffs. But anyways, I think in your exam they will mostly ask you uncuffed tubes. Okay, 1 and 2. Staphylococcus has mentioned that 1 is South Pole, 2, Swapnil is saying 2 is South Pole. So 1 is South Pole or 2 is South Pole? Okay. First of all, both of these tubes are called as RAE tubes or ring Adair Elvin tubes. They are named after 3 people, 3 scientists, ring Adair Elvin. They are used in head and neck surgery or neurosurgery. Okay, so wherever you want the tube to stay out of the way of the surgeon's area of operation, because the surgeon may be operating in the same area where the tube is. So in that case, we use this RAE tubes or ring Adair Elvin tubes. Okay, so this tube is called as the North Pole tube, and the one where both the ends are on the same side is called as the South Pole tube. Okay, now how does the North Pole tube go? This part that is there from here to here, this goes in the trachea only. This above wala part that is there, it will go like that towards the north, towards the head. And this one South Pole tube, again this to this will go inside the trachea, and this part will go down towards the south like that. Okay, so this is the North Pole tube and South Pole tube used for any kind of head neck surgery so that the tube stays out of the way of the patient. Alright, okay, now what about 4 and 5? Anyone? 4 and 5. Now 4 is a normal tube, normal endotracheal tube with cuffed, or you can call it as a cuffed endotracheal tube, and 5 is having these metallic rings inside. You are not able to see it, so I will show you in the next picture. So 5 is picture number 1 and picture number 2 over here. So this is number 5, both of them are same, same tube. And then we have number 6. So can you guys identify for me tube number 5 and tube number 6? Braided tube. What is braided tube? There is no braided tube. ब्रेडेड ट्यूब करके कुछ नहीं है. कैन यू सी देर आर मेटालिक रिंग्स इनसाइड द ट्यूब. इसमें भी मेटालिक रिंग्स है इनसाइड द ट्यूब. सो दिस इज कॉल्ड एज द फ्लेक्सोमेटालिक ट्यूब. फ्लेक्सोमेटालिक ट्यूब, or this is also called as the armored tube. Okay, so what is the use of flexometallic tube or armored tube? So this flexometallic or armored tube that is there, it basically does not kink if you bend it. Okay, so if you bend it, it's not like the flow of gases through it will get obstructed. The tube will maintain its diameter and its shape and it will not get kinked. Okay, so this is called as flexometallic or armored tube. And anyone, what is number 6? What is number 6? Any idea what is number 6? Okay, number 6 is nothing but double lumen tube. This is double lumen tube. Okay, so what is double lumen tube used for? Anyone? Double lumen tube is used for thoracic surgery. So whenever you want to do one lung ventilation, we use double lumen tube. Okay, So how do you identify a double lumen tube? It's very easy. You can see it has two ends over here, it has two cuffs over here, pilot balloons over here, and these two pilot balloons will inflate these two cuffs. So that is called as the double lumen tube, used for lung surgery. Okay, so if you want to suppose operate on one lung, this is your trachea, bronchi, and this lung, if it has you want to inflate this, the other lung, suppose it has a tumor over here, so you keep the tumor wala lung deflated so that you don't cut through the parenchyma of the lung much, and this other lung that is there, you inflate it to maintain the oxygenation of the patient. Okay, so this is the use of your double lumen tube. Alright, so we have all the tubes covered. Over here you have the north pole, south pole, uncuffed, cuff tube, armored tube, and double lumen tube covered. So these are all the tubes that we use in anesthesia. Now next set of instruments that we have over here, can anyone identify these instruments for me and tell me what is the use? So number 1, number 2, number 3 and number 4. And what are all of these called as, and what are they used for? Okay, very good Staphylococcus, very good Hriday. So 2 have been identified. One is called as the Giddels oropharyngeal airway, barabar. And what is 2 called? 3 is called as bougie, excellent, blue colored bougie. What is 2 called? Two and 4, anyone? Okay, first of all, what are all of these called? Okay, so the important thing is all of them help in intubation. So they are or in mask ventilation of the patient. So they are called as airway adjuncts. So they help in maintaining the airway, maintaining oxygenation either by mask ventilation or they help in intubation. Okay, 2 is called as nasopharyngeal airway. Nasopharyngeal airway. Okay, and what is 4? 4 is called as a stellate. Stellate. It is a steel colored, it is a steel stellate. Now what is the use of all of these? So you see, your oropharyngeal airway that is there, you put it inside the oropharynx, so it will push the tongue forward and it will maintain the patency of the airway. Your nasopharyngeal airway, you can see it is going through the nose and it is going behind and it is pushing the tongue forward. So this is your nasopharyngeal airway, again helps in maintaining the patency of the airway. Then the blue colored one that you can see is your bougie, and the steel one is your stellate. So what does your bougie do? Your bougie will basically, so when you are intubating the patient, if this is the view, you can see the epiglottis, and instead of seeing the entire vocal cords, if I am able to see only piche ka thoda sa vocal cords, then in that case first I will pass the bougie, and on top of the bougie I will pass the endotracheal tube. Okay, then what is the stellate used for? Stellate is used if you have a very anterior larynx and you want to intubate the patient. So you put the stellate inside the endotracheal tube like this. So normally the stellate is like this and the endotracheal tube is straight. So with the stellate you can curve the endotracheal tube forward like that, okay, and you can intubate the patient with anterior larynx. So bougie and stellate both help in intubation. Oropharyngeal and nasopharyngeal airway help in maintaining the patency of the airway and ventilating the patient. Okay, so all of them are called as airway adjuncts. Okay, now question that comes in the exam, they'll give you these 4 images and they will ask you, suppose a patient has a seizure and you don't have a bite block available and the patient can have a tongue bite. So what can you use out of all 4 of them to prevent the tongue bite? To prevent tongue bite in patient, what can you prefer out of all 4 of them? What will you prefer to use? Yes, very good. So in case of a tongue bite, to prevent a tongue bite, to use as a bite block, you can use Giddels oropharyngeal airway. Okay, alright. Now next, and this would be the most important slide for us. So you have to identify what are all these instruments? There are almost 1 2 3 4 5 6 instruments over here. You have to tell me what is the class of instruments and what is the use of all these instruments. And this is the most important slide nowadays because all these instruments were used during COVID. So every year they are asking one question in the exam. One is 100. What is 100? Identify the instrument first. Okay, Hriday is saying 2 is oxygen prongs. Okay, rather it is called as nasal prongs. Nasal prongs, barabar. 3 is called nebulizer mask. Yes, or it is called as Hudson mask, barabar. 4 is called non-rebreathing mask, barabar. Okay, how do you identify non-rebreathing mask? It has this bag attached to the mask. So you will get oxygen from 2 places, from the mask as well as from the tubing. Alright. Okay. 1 is HFNC. Very good, Swapnil. High flow nasal cannula. What are the parts? It is made up of a flow meter from where the high flow of oxygen comes, goes to this pipeline, goes to the humidifier. The oxygen gets warmed and humidified and it goes inside the patient's nose through these nasal prongs. Okay. Alright. What is 5? 5 is NIV. Very good, Swapnil. Non-invasive ventilation mask. So how do you identify it? There is a ventilator and from the ventilator you have this circuit that is going inside the patient and you have a mask that is very tightly attached with straps to the entire face. So you are giving non-invasive ventilation to the patient through the ventilator. And 6, very good, Rameshwar, is nothing but oxygen helmet. It looks like a space helmet, so this is your oxygen helmet. Okay. Alright. Now, can you guys tell me the maximum FiO2, the maximum FiO2 given by each of these instruments? So you tell me 1 ka FiO2, 2 ka FiO2, 3 ka FiO2, the maximum FiO2 that can be given by each of these instruments. बोलो. Okay, very good. HFNC maximum FiO2 given is 100%. Nasal prongs, Swapnil is saying 4 also gives 100%. No, that's not correct. NRBM does not give 100%. NRBM gives 80%. Very good, Hriday. Maximum FiO2. Now this question was asked in the exam this time in NEET PG. Nasal prongs gives how much FiO2? Very good, Swapnil. So nasal prongs will give maximum FiO2 of 40%. Nebulizer mask. Nebulizer mask gives maximum FiO2 of oxygen prongs 30 to 40%. Acha. Nebulizer mask gives maximum FiO2 of 60%. NIV mask gives maximum FiO2 of 100%. And your oxygen helmet or oxygen hood gives maximum FiO2 of 90%. Okay, writing over here 90%. Okay? So these are all your oxygen delivery devices and the maximum FiO2 that they give. You have to know all this because exam में ये पूछा गया है already. Okay, last time they have asked this about NRBM. What is the maximum FiO2 given? उसके पहले INICT में they had asked to identify high flow nasal cannula, and only when you follow such flashcard image based revisions will you be able to answer such tough questions. And when you answer tough questions, automatically your rank will go up very high. Alright. So please remember this slide, guys. It's very, 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 very important. Okay. Can anyone tell me with intubation what is the maximum FiO2 I can give? Now intubation is also an airway maneuver, or it is a method of providing oxygen. Oh yeah, I forgot to tell you what these devices are called. So all of them are called as oxygen delivery devices. They help in delivering oxygen. So they are called as oxygen delivery devices. Okay, so can anyone tell me Yes, with intubation, maximum FiO2 that I can give is 100%. So there are 3 devices that can give up to 100%. One is HFNC, one is NIV, and one is intubation. Okay, alright. So these are the different positions of surgery, and you have to identify every position. Now A, B, C, D, E, F, G, H, I is written over here. Identify every position and tell me the associated complication with every position, or something that you will be careful about with every position. Okay, very good. One is supine position. Now exam में पूछा था what is this position? This position of head up is called as reverse Trendelenburg. Most of you all ended up marking it as Trendelenburg and got it wrong in the exam. Okay, what is position B? Position B is Trendelenburg. Yes. What is position D? D is lithotomy. E is lateral, but tell me what lateral position is it? Is it right or left lateral position? Right or left lateral position? Okay, so the lower side is the right side, so this becomes the right lateral position. Okay, F is kidney position. So F and G is the same, it is kidney position. What is H? H is prone position. And what is I? I is, what is the name of I? You all can't see? Abhi dekho. Okay, so I is called as Fowler's position, or it is called as sitting position. Okay, or it is also called as beach chair position. So these are all the positions in anesthesia that we have. Now you need to know the associated complications with each of these positions. So with supine position, what is the associated complication? Anyone? Patient is lying down supine. Where all can he get hurt? He can get hurt on the pressure points. Okay, so supine position mein you can have pressure points like your your occiput, your shoulders, your hips. All those areas can get pressed and there can be pressure sores on them. So you have to make sure there is enough padding below. In Trendelenburg position, your head is going down. So as a result of this, you can have raised intracranial pressure, raised intraocular pressure in this position because all the blood is rushing towards the head. Okay. Reverse Trendelenburg is ulta. All the blood is rushing towards the feet. So as a result of this, your venous return will be low. So you can have fall in ICP, fall in IOP, and most importantly, fall in your venous return. So that will cause hypotension in the patient. Okay. Now, what is the most commonly affected nerve in lithotomy position? In lithotomy position, what is the most commonly affected nerve? Guys, at 11:15 we have special class, okay? Flashcard revision of pediatrics. Okay, so in lithotomy position, as you can see, what is the nerve that would be touching the stirrups over here? The nerve that would be touching the stirrups over here is nothing but, no, not sciatic nerve, your common peroneal nerve. Okay, so the common peroneal nerve against the neck of the fibula can get compressed and you can have your compression of CPN over there. Okay, now in the lateral position, the lower pressure points of the body can get affected. Then in the prone position, your eyes can get compressed. So in the prone position, they commonly ask this question: what is the most important thing that you should look for. So the most important organ that you should be looking for in prone position is your eyes, because eyes can get compressed. You can have increased arterial or venous pressure in the eyes, and as a result of this you can have eye injury. Okay, and in Fowler's position, sitting position or beach chair position, which is used in neurosurgery, what do you expect can happen? One of the very disastrous complications can happen in this case. Any idea? What is the disastrous complication that can happen in Fowler sitting or beach chair position? It is nothing but venous air embolism. Okay, so venous air embolism mein whatever air is there in the atmosphere, it will enter through the open vessels in the brain, because you are operating on the brain, and then the air will enter into the heart, and then from the heart the air will go anywhere in the body. Okay, sorry, from the heart the air will stop the blood from going from the right side of the heart to the pulmonary artery. It can cause hypotension and desaturation. Okay, so this is what you see in Fowler's or sitting position. Alright, and with that, the last thing that we will discuss for today is the fasting guidelines. So you have to tell me what is the fasting guidelines for clear liquids, what is the fasting guidelines for a full fatty meal. बोलो, ये दोनों का बोलो. To prevent aspiration, when should we last have clear liquids? Yes, so clear liquids should be last have had 2 hours prior. In clear liquids we talk about water or black tea or coffee, because black tea or coffee is also a clear liquid. Okay, anything else? Okay, cow's milk, what is the fasting guideline? Cow's milk, buffalo milk, goat milk. 8 hours for full fatty meal, very good. Mother's milk, yes, so breast milk is 4 hours. Excellent. What about cow's milk or light meal? Yeah, so cow's milk or light meal is 6 hours. Okay, now if they want to confuse you in the exam, they will give questions like this. A baby is on formula fed milk. What is the fasting guideline for formula fed milk? Are you sure, Nimita? Yeah, so correct, for formula fed milk fasting guideline is 6 hours. Okay, then they will say a baby had 1 spoon of khichdi. 1 spoon of khichdi. What is the fasting guideline for this? Just 1 spoon of khichdi. बोलो. तो इतना सिंपल नहीं देते हैं वो लोग एग्जाम में. दिल घुमाओ फिराओ एंड आस्क यू. Okay, so khichdi is a full meal. Please remember that it is not a light meal. So khichdi 1 spoon khaya ya full plate khaya, you have to wait for 8 hours. Okay, and the last thing that I wanted to ask you guys is coconut water. Coconut water के लिए fasting कितना है? ये भी पूछते एग्जाम में. कोकोनट वाटर, is it a clear liquid or is it not a clear liquid? Okay, so एग्जाम में तो ये नहीं बोलेंगे मलाई डाल के दिया था या नहीं, but you have to assume that coconut water they are mentioning without the coconut का that white part. Okay, so it is a clear liquid only, and the fasting guideline for coconut water is nothing but 2 hours. Alright, so with this we complete today's revision of short subjects. Of course, there is more of anesthesia left for revision. We'll be taking that in the next class. Now these are all, so I'm just quickly showing you what all we discussed, and also remember at 11:15, that is 15 minutes from now, we have a special class in which we'll be doing pediatric flashcard revision. Okay, so we did the fasting guidelines, we did all the positions of surgery, we did all the oxygen delivery devices, all the airway adjuncts, all the endotracheal tubes, all the laryngoscopes, all the LMAs or supraglottic airway devices, and the cylinders or the instruments, and everything about local anesthetics and last. Okay, so this is what we have discussed today. The next time we will be discussing some more things, especially the anesthesia machine, Mapleson circuit, your closed circuit, all those things that you all get confused about. And I'll make sure that we finish this before the exam so that you all are well prepared for the exam. Okay. Now you can always watch this flashcard revision at 1.5x the speed before the exam, 1 week before the exam, to revise your entire anesthesia. Alright. So thank you so much, guys. If you like this video, please don't forget to leave a thumbs up at the end of it, and I shall see you guys at 11:15 on special class platform, free class. Thank you. Bye bye.